Hi, everyone. My name is Steve, and I'm a licensed psychotherapist. And I have another very exciting episode for you today. Today, we're going to be speaking with Dr. Curtis Branch, who's also my mentor. And I'm happy to speak with him because he's going to give an interesting take on the field of clinical psychology. So, to start out, Dr. Branch, would you just like to introduce yourself and maybe give one interesting fact about you?
Okay. Hi there. My name is Curtis Branch. I am a clinical psychologist. Um, I'm not sure what others might consider interesting, but one of the things that I find interesting about myself is that I've been uh, devoted to this field of work and study for actually almost 50 years.
Hmm.
So it's something that I didn't just come to or didn't just discover, but it's something I've grown up with and grown up on.
Hmm. I love that. Okay. Now, for people that don't know, they hear clinical psychologist. What exactly is a clinical psychologist?
Well, a clinical psychologist is clinical refers to the specialty.
Mhm.
Psychologists are people who, by definition, are interested in behavior, both humans and animal. But clinical psychologists are interested in and work primarily with behaviors that take people outside of normal experiences and or behaviors that become problematic for the person who's engaging in the behavior and or problematic for others who are the recipients of the behavior. It's a subspecialty within psychology that's devoted to growth, development, and improvement. But I guess, overarching assumption is that the participant in this growth and development is willing to be engaged in such an endeavor.
Hmm. I really,
Yeah,
really love that.
yeah, and I guess by that I mean it's one of those areas that it doesn't work if the people who recipients of it don't want to be there or don't want it. It's not something, as I occasionally encounter people, where somebody tells them they're going to make them be in therapy. And well, you can make them come to an appointment, but you can't really make them get engaged or believe in the process. That really has to be a voluntary kind of activity, which for some people, that's not initially the situation. They have to grow into it or warm up to it or discover that it's not something that's going to be physically harmful to them, and that the psychologist is not some, I don't know, monster or somebody who sits somewhere and calls down the wrath of God or something like that.
Right. Okay. Could you tell me a little bit about the schooling it takes to be a clinical psychologist? So I think about most people will have to go to undergraduate 4 years and then graduate school. What's the schooling or training it takes?
Well, it takes a significant amount of training, and uh, I guess college or bachelor's degree is really the super basic requirement. And of course, having a bachelor's degree doesn't qualify you to be a psychologist. And unfortunately, these days, it probably doesn't qualify you to be very much of anything other than in a position of seeking some more credentials and trying to, as it were, find your way in life. But that's a very basic requirement for clinical psychologists. Then comes graduate school.
Mhm.
And for many people, the first stages of graduate school is what helps them really decide what specialty they want to pursue. And I hasten to point out that not all psychologists are clinical psychologists.
Hmm.
There are social psychologists who study group behavior. There are developmental psychologists who study growth and development across the lifespan. There are physical, I'm not sure what they call themselves these days, but physical performance sports psychologists, that is, who help people with that. There are industrial psychologists who study things like the development of technology that gives rise to Zoom and computers and issues in the workplace. There are psychologists who study nutrition and food tasting. There are psychologists who study traffic patterns. There are psychologists who study travel patterns. There are psychologists who study parent-child relations, and sometimes they are actually clinical psychologists. There are psychologists who study perception and sensation. Those are the people who help ophthalmologists and people develop instruments to measure the accuracy of our vision and our capacity to uh, experience stimulation in different parts of our bodies. There are psychologists who help physical therapists with training for rehabilitation for people who sustain or experience the loss of some bodily functions. So there are a whole plethora of types of psychologists. Clinical clinicians are just one of several.
Hmm. I love that you gave that because a lot of people say, well, I'm a psychologist. And I mean, that can mean so many different things. But let me ask you
That's
this.
right.
What do you think? So, what are some of the settings that clinical psychologists work in?
Well, clinical psychologists, as I said, are interested in helping people with behaviors that are problematic, even thinking that's problematic. A large number of clinical psychologists work in medical settings. So they are there to be a part of treatment teams. So as people undergo medical care and they have periods of doubts and depression and even anxiety about their medical conditions, clinical psychologists are there to help with that. There are people who enter into drug treatment, rehabilitation. Clinical psychologists are trained, many are trained to help in that area also in the format of individual psychotherapy, group psychotherapy, family psychotherapy. So clinical psychologists work in a variety of settings, medical settings, private practice, and by private practice, I mean an office independent of an institution. I maintain a private practice, so I'm not a part of a hospital or any larger institution at this point. But clinical psychologists, interestingly, work in the travel industry. So, as people fly around the country and may have periods of stress, certainly in response to some of the things that have been happening on airlines lately, someone may get overwhelmed with feelings of doubt and fear, or in the horrible aftermath of airline accidents. Clinical psychologists are people who are called upon to assist in that area. Clinical psychologists work with law enforcement. Indeed, in New Jersey recently, there have been some legislation that has altered the way police officers respond to crises, and some push toward including clinical psychologists or other mental health professionals on the crisis teams to go out to talk people out of threats to harm themselves and or others. So private practice, hospital settings, some few schools actually have clinical psychologists on their staffs. Frequently, they rotate between several schools, but they are indeed available to school-age children, parents, and teachers and administrators on a regular basis. Let's see. I mean, you name it. Any place that there are people and there are behaviors that sometimes become the source of challenges or disruptions for people. My guess is that it's not very far from that place you will find a clinical psychologist.
Hmm. Okay. And what does a typical work day look like for you for someone that may be interested?
Well, my typical workday is probably not typical for most of my colleagues. I am semi-retired, having spent 20 plus years working in medical settings. Well over 20 years, but most recently 20 years at one particular medical uh, setting. So I'm no longer affiliated with that institution. So I maintain a private practice office, meaning that I schedule patients whenever I want or consistent with when they are available. My recent pattern of work has been that the day is split. And by that, I mean I have a small group of patients who come early in the morning before they go to their jobs, as in 7 o'clock in the morning. So it's a couple of days a week. I do have 7 and 8 o'clock appointments. And then I don't see anybody through most of the day. And my next appointment would be at 5 o'clock. So I schedule at 5, 6, and 7. And again, consistent with the incredible request for services. Now I've started to keep Saturday morning hours in the office, but those are devoted exclusively to school age children who perhaps could not come at 5 or 6 o'clock in the afternoon because of after school activities or because of parents' work schedule or just because by 5 o'clock they've just run out of energy. They're not wanting to go see some therapist to talk about things that are upsetting to them. So for me, a typical day is 7 and 8 a.m. at least 2 days a week. Then nothing the rest of the day. I get to have the day to do with it whatever I want to do, personal and professional. And then 5, 6, and 7 o'clock. And lastly, Saturday mornings, uh, 9, 10, and 11 o'clock.
Okay. Now, for the person that wants to know, well, hey, I've thought about seeing a clinical psychologist, but what does a session look like for someone that's never been to therapy before?
Well, I hasten to point out to people that the media and television and movie portrayal may not accurately reflect what happens or what to expect. Clinical psychologists are uh, well, people and are potentially engaging and all of those things, but frequently people show up with some expectations of something very different. Uh, Typical session, really revolves or evolves from greeting a patient with, hi, how are you? How's your day going? How have things been since last we met? And for people who are continuing, it's a statement of how things have gone since our last session. And for me, it invariably sort of really starts to focus in on the work when we review what happened in our last meeting. And I ask people whether or not there's any leftover or lingering thing from the last session. Frequently, the answer is no. So I simply ask people, gee, where would you like to start today? So
Mm.
they become the driver, so to speak. And I like to remind people it is their session. So they can talk about whatever they want to talk about or not talk about whatever they don't want to talk about. My job is to be there to assist them in that exploration and help produce clarification and more information as needed to sustain this exploration process. And then, of course, I am the explicit timekeeper. Typical sessions are 50 minutes. The I just have a clock in the office, but I think most people have figured out what the clock is there for. So I have disabled the clock. So now most people know that, gee, the time on this clock doesn't ever seem to change. It must be broken. So, and they're right. But I do discreetly keep track of time so that as we are nearing the end of our time, I can say to a person, we have a few minutes left. Are there other things that you want to explore or uh, talk about today? Again, the answer frequently is no. And if that's the answer, then if we have administrative things to talk about, we'll typically use the last 3 or 4 minutes of a session to do that and to reconfirm the date and time of our next meeting.
Okay. No, very good. And I love the approach where it's not dictatorial and you allow clients to really guide what they think is important to them.
Yes. Well, I mean, that's part of why they're there. And I do say to people when they come for a first time, what is it that they want to accomplish by coming to see me?
Yeah.
And some people have a very clearly thought out and sorted out, I guess, list of things or areas they want to work on. Other people have maybe less well fleshed out things and will say things like, oh, I just want to be happy. And I'm saying, well, gee, how does happy look? What is happy? How do you define that? How do you know when you're there?
Mm.
So that's part of the work of helping them set the standard for themselves and know when they have reached that plateau.
Okay. Now, are there any specialty populations that you enjoy working with or anything like that?
Well, I particularly enjoy working with children who are, well, the requirement, of course, is that they are verbal.
Mm-hmm.
I don't do infant uh, or pediatric work. Every now and then, a parent will want to bring a 3-year-old child to therapy. And there are people who do that level of engagement and treatment frequently in therapeutic nurseries and things of that sort. The other thing I hasten to point out about seeing anybody, I remind people that my work is outpatient psychotherapy. So that is under normal circumstances once a week. Um, some people, as they get deeper into what they're working on or because of workplace demands on their time, ask to come once every 2 weeks. That's fine. But for me, that's an absolute minimum. I talk with people about their having taken the step forward to indicate they want to work, and my interpreting that to mean that they do indeed want to work, meaning that it requires consistency of effort. It's not crisis intervention that when you have a fight with your girlfriend, boyfriend, or significant other or a spouse, then you want to come to therapy and then don't come back for 5 weeks because everything is good. I'm saying, well, I suppose there are people who sort of adhere to that model. That's not what I think makes the difference in people's lives. It's consistency, and indeed, for me, with most people, there is a contract. And the contract says that they agree to come for scheduled appointments. They agree to pay their bill. They agree to be on time. All of those things. And we have rules, not a lot, but we have 2 or 3 rules. And one of them is about time, that it's a 50-minute session. So 15 minutes after the session is scheduled to begin, if it has not started, the session is canceled. Yeah, every now and then somebody gets stuck somewhere in traffic, but Now, the beauty of having mobile phones is you can call to say, I'm on Route 17 and the traffic is a killer and I'm on my way. Fine, okay, but do understand your appointment is from 5 until 5:50.
Right.
You can't show up at 5:30 and expect that you're going to get 50 minutes.
Mm,
Uh, Usually because there's somebody else scheduled at 6 o'clock.
right.
So having understandings with people about the parameters of what we're going to do usually helps things get off to a good start.
Gotcha. Now, talk to me about, has there ever been any challenges up until this point? Because I know you spoke about you had to get your bachelor's, then you went beyond for, doctoral training, postdoctoral training. Have you had any challenges that you could think of?
Well, there are always challenges. The changing demands of the world in which we live. It's not a particular challenge, but it's a pattern that has emerged over the past 2 or 3 years that many people are wanting to do therapy remotely. They don't want to come to the office. Some of it is driven by precautions about infections and things of that sort. Uh, but some of it is also driven by people just, I guess, being lulled into contentment with convenience
Yep.
that, gee, I can just get on a Zoom call and talk to that doctor and then turn off the call and go on with my life. I don't have to drive over to his office. I don't have to uh, physically encounter him. I mean, looking at someone on a screen is very different from being in the room with them.
Mhm.
So that's been, I guess, a social challenge, not just, I think, in the mental health field, but certainly I hear reports from workers, the same thing in the workplace, that people are almost insisting that they be allowed to work from home. And indeed, in some corporate settings where the employers have decided, no, we hired you to be here to be a part of the team, and on and on and on, and we've assigned you an office, so you are expected to be here. And I certainly hear of legal challenges to that recently, where people are saying, contract negotiation says that all the workers in this union should be given the option, So I try to steer clear of that, but and one of the ways is being very upfront with people when they come in initially. I tell them that the pandemic is officially over. I think the effects of it are with us and will be for quite some time, but I have suspended virtual appointments as a regular way of engaging patients. So all of my work is done in person.
Mhm.
The exceptions to that, of course, are for people who are established patients who periodically have days in which they are not particularly feeling well, but they are well enough to have a Zoom session. But again, every now and then I'll get people who'll come in and actually want to argue with. They should be extended the opportunity to meet on Zoom because they're busy and they got a lot of stuff to do and on. And I said, well, I do understand that, but that's not the nature of this beast here. This is face to face. We're making it very clear from the outset. And just perhaps this is not a good combination that, there are, I'm sure, mental health colleagues who will engage that and who use that as their primary venue of interacting with uh, clients. That's not true for me. I will do it in extenuating circumstances. If someone changes jobs and the new job is 60 miles away and it creates a hardship for them to come in, we can do that. Or if someone or their spouse has a baby and they've got to share in the child care arrangements and can't always come uh, on a regular basis in the way that they used to, then we can do something there. But to just say, I only want virtual appointments, well, that's a stated desire and request, one that does not match very well with my mode of operation.
Okay. And we're coming down to the last few minutes. What's your favorite thing to do outside of your job?
Well, I don't know. I have several things that I guess would qualify as hobbies or points of interest and fascination that are not mental health focused or even psychology at work. Um, I don't really know. I do like experiencing a variety of dining options and experiences. And so I would say trying out different restaurants that has sort of been a long-standing point of interest, one that lately has gotten mixed reviews, partly because I'm convinced that many restaurants, how they present themselves in print and online is absolutely at variance with how they are in reality.
Right.
I mean, and I certainly do understand the power of professional photography, that people could take pictures of food items that really look award winning and look like the kind of thing that Julia Childs or someone would have really lusted after.
Hmm.
And then you get there and it's like, oh, but this is not quite what I saw online, or the ambiance doesn't exactly match what you thought you would get. So that's become, I guess, an area that I continue to enjoy, but I'm becoming increasingly discriminatory about where I spend time and money.
Okay. What's your favorite self-care strategy? Some people say journaling, or some people say exercise.
Um, I think just periodically uh, experiencing again variety of music
Yeah.
that and certainly in this metro New York area, there are no limits to what kinds of things and where. So having a even a catalog of places and things to experience at will and even spontaneously. Radio, I suppose, despite that, there are one or two variations of music that haven't quite I haven't quite developed a taste for yet, so I'm a little gun shy about them. But everything else, I'm open to hearing people talk about. Some oh well, fascinating thing, opera, for example. That most people have some strange, contorted vision of what opera is or is not. And more recently, the shift in that genre has been fascinating to know that, there are musicians who write operas and the music is really jazz and other kinds of things infused into the storyline with characters. So it's not just people parading around on the stage in powdered wigs and things of that sort. So that's one thing. Or the availability of live streaming of concerts that different musicians uh, carry out. So music, all kinds of music, and just at I guess a blink of the eye can in this area have a range of options that people in other parts of the world only dream about.
Okay. And final question, what advice would you give to an aspiring clinical psychologist?
I think the idea of experiencing a range of work settings early in even your pre-psychologist career, I think many of us have notions of what we're interested in, or, the standard phrase of I want to help people. Well, you can help people in lots and lots of ways. Maybe psychologist is not the way to help that will allow you to get what you need and want from the experience. But if people are already on track to become a psychologist, I would say have a range of exposures certainly completing an internship where you have very intense clinical supervision and training opportunities to help you really find your niche, what it is that works for you and that you think you can make a significant contribution to the world and to the field by laboring in that vineyard.
Okay. Thank you so much. I really appreciate you joining, Dr.
Okay.
And you're a person I learn a lot from, so I really appreciate the audience getting a chance to hear from your wisdom. If you've been
Yeah.
out there watching, just like, subscribe, and comment, and we'll see you in the next one.
Okay. All right. Thanks, Steve.